All right, let's talk about something that happens in a flash but can last a lifetime. Burns. We're going to break down what they are, how doctors figure out how bad they are, and, this is the big one, the first aid that could seriously change the outcome for someone. So, let's dive in.
Okay, so here's a question for you. What do a really bad sunburn, an electric shock, and road rash from a fall all have in common? I know it sounds like a weird riddle, right? But the answer is actually pretty straightforward, and it's what we're all about today. All of them can give you a burn.
And that brings us right to the official definition. See, a burn isn't just about fire. Not at all. It's any injury to your skin and tissues from a whole list of things: heat, chemicals, electricity, radiation, even friction. But here's the really important part to grasp. Burns do two things. They destroy tissue and they cause you to lose fluid. And that second one, the fluid loss, that's what makes really bad burns so incredibly dangerous.
I mean, just look at how many different ways this can happen. We all think of the classic thermal burns, right? Flames, hot water, that kind of thing. But you can get chemical burns from things like acids, electrical burns, radiation burns, yep, that's your sunburn, and friction burns, just like road rash. It really opens up what the word burn actually means, doesn't it?
Okay, so when a doctor or a paramedic sees a burn, they're immediately trying to figure out how bad it is. And they do that by looking at two main things. This is super important because it decides the treatment. So let's get into those two factors: depth and extent.
So first up, let's talk about depth. You've definitely heard of this before, first degree, second degree, third degree burns. It all boils down to one simple question: how deep did the damage go?
All right, let's start with the most common one: a first-degree burn. The perfect example? A mild sunburn. It only gets that very top layer of your skin, the epidermis. It's going to be red, it's going to hurt, for sure, but the good news is it usually clears up in about a week, no scar.
Now we go a little deeper, we've got second degree burns. And these are a step up in seriousness. They damage not just the top layer, but the one underneath it too, the dermis. The big telltale sign here? Blisters. If you see blisters, you're probably looking at a second degree burn. They're super painful, and yeah, they might leave a scar when they're done healing in a couple of weeks.
Okay, now we're getting into the really serious stuff: third-degree burns. This is a full-thickness burn, meaning it has destroyed all the layers of the skin. And here's something that sounds really weird, but it's incredibly important. These burns often don't hurt. And you might think, how's that possible? Well, it's because the burn was so deep it completely destroyed the nerve endings. The skin can look kind of white or leathery, even charred. And this isn't something that just heals on its own. It's going to need surgery, like a skin graft. And then there's the most severe of all: a fourth-degree burn. This is just devastating. It goes past the skin and damages the muscle, tendons, sometimes even down to the bone. The tissue looks black, charred, and in these worst-case scenarios, amputation might be the only option. Okay, so that's depth. We've got the degrees down. But that's only half the story. The other critical factor is extent. So it's not about how deep the burn went, but how much of the body it covers. Doctors call this the total body surface area, or TBSA for short. And in an emergency, you need a way to figure that percentage out fast. So doctors came up with this really clever shortcut. And it's all based on one number: 9. It's called the rule of nines, and it's a super smart way to quickly guess the burn size. Basically, they've divided the adult body up into sections of 9%. So your whole arm is about 9%. One leg is 18%, that's 2 nines. The front of your torso, 18%. The back, another 18. It's simple math that lets a first responder quickly add it all up and realize, whoa, this is a major burn. This person is going to need a ton of IV fluids right now. So we've talked about what we can see on the outside, but with a big burn, there's a huge crisis happening on the inside. It's like the body's alarm system goes haywire. And this internal reaction, that's what makes a large burn so life-threatening. So check out this dangerous chain reaction. It all starts with the tissue damage. That damage makes all your tiniest blood vessels, your capillaries, start to leak. And they just pour fluid out of your bloodstream. So what happens next? Your blood volume just tanks. That condition is called hypovolemia. And from there, the body can go into shock. It's this deadly domino effect that doctors have to stop, and stop fast. Okay, so knowing how dangerous this is, what can you do if you're ever there when this happens? I'm not exaggerating when I say this next part is probably the most important thing we'll talk about. This is the first aid you absolutely need to know.
What you do in those first few minutes is everything. All right, here are the do's.
Number 1, stop the burning. Get them away from whatever caused it. Number 2, cool the burn. Get it under cool, and I mean cool, not ice cold, running water for at least 10 minutes. This is so important because it actually stops the heat from continuing to damage the tissue underneath. Then, carefully take off any tight clothes or jewelry around the area, and last, cover it up with a clean cloth. Now for the don'ts. This is just as critical. Do not put ice on it, you can actually make the damage worse. And please ignore all those old wives' tales about putting butter or oil or toothpaste on a burn. All that does is trap the heat in and raise the risk of infection. And one more thing, whatever you do, don't pop the blisters.
So, after that critical first aid, the road to recovery from a serious burn, well, it's a long one. It takes a lot of intensive medical care, which is why the best strategy of all is, you guessed it, making sure it never happens in the first place.
Just to give you an idea of what happens in the hospital, to fight that crazy fluid loss we mentioned, doctors pump in enormous amounts of IV fluids. They even have a special formula to calculate it, called the Parkland formula. And then there's constant, careful wound cleaning, really strong pain meds, and often multiple surgeries like skin grafts to start rebuilding what was lost. But, we can try to avoid all of that. Prevention really is key. And it's the simple stuff, right? Being careful when you're cooking, making sure the electrics in your house are safe, handling chemicals with the right gear, and just having the basics of fire safety down, like working smoke detectors. It all makes a huge difference. So we've gone through a whole lot here, from the science of what a burn is to what to do in those first critical moments. But knowing this stuff is one thing. Putting it into practice is another. So I want to leave you with a question to think about. What's one small thing, one fire risk in your home that you can go and fix right now, today? Thanks for joining me.